Good morning. It is 8:32, and they said the prompt would start at 8:30. So we're going to get started. My name is Dave Carlson. I'm a consultant with McGohan Brabender, and on behalf of McGohan Brabender, I'd like to say thank you for being here. For those that are returning, welcome back. We are extremely happy to have you, and for those that are here for the first time, we really hope you enjoy this, get a lot of information from this, take us back to where you are and help you to make decisions and have discussions that really need to happen. Today, Tiffany Rigas, our very own, will be speaking to you about wellness. She is our health management and engagement specialist. She is literally the best person to talk about this with you. Her background is with the last 10 years. She's been with the YMCA in Indianapolis and the Walt Disney Company. There she learned to communicate with families and children about living a healthy lifestyle. And she has a degree at the University of Kentucky in Family Studies and Communication and Leadership Development. She's also accredited with the Wellness Council of America, the nation's premier resource for workplace wellness. So please give a round of applause for Tiffany.
So, welcome everybody. Thank you all for joining us today. It's so great to see a lot of familiar faces. So my name is Tiffany Rigas. As Dave said, I am the Health Management and Engagement Specialist here at McGohan Brabender. So what I do is I work closely with our clients to help them implement different strategies around health management and wellness. We don't want to just throw health management into a company without communicating properly and having the right strategy and leadership all involved. So I am here as an added resource to McGohan Brabender to help everybody, to guide our clients on how we want to implement those strategies. So at McGohan Brabender, we talk a lot about the entire healthcare dollar. We have the 13 cents versus the 87 cents. That 13 cents, it's really hard to change. Those are the administration costs. You have the insurance carrier fees. And so we like to focus our main portion on the 87 cents. That 87 cents is that clinical data versus the non-clinical data. What can we implement in our own culture and company to really focus on that? And then how can we empower our employees to be good, smart people effectively managing the entire healthcare dollar? So at McGohan Brabender, we empower business, empower people, and empowering healthier living. So today we're going to talk about the essentials of having a successful and meaningful health management plan. What does that mean? What's the difference between wellness and health management? So some goals and objectives that we have today are discussing building a culture, biometric screenings, metabolic syndrome, diabetes. How does that affect our 87 cents of the healthcare dollar? Preventative exams and preventative care. Tobacco use and how that affects the dollar. ACA wellness rules and how they've recently changed. Financial benefits of having a meaningful and successful health management plan. And then we'll go through some Milliman studies results. So throughout the presentation, it's not going to be 90 minutes of sitting here listening to me. We're going to have a couple of different things. We'll have a game show, we'll have some get up and move arounds, and then I'll ask for some audience participation. Okay, so let's start with this. So how many? So let's look at our slide of 100 people. So pretend like your company, 100 employees. So we have 12 different risk factors over to the right side. Overweight, pre-diabetes, obese, high triglycerides, high blood pressure, smoking, diabetes, high cholesterol, chronic pain, sleep issues, fail to get enough physical activity, and struggling with stress. These are things that your employee population is dealing with on a daily basis. This is really affecting the bottom line of your guys' dollar. So I could sit up here and I could tell you the statistics of all of these, but what fun would that be? So we're going to play a little bit of a game show, and I'm going to need all of your guys' help with this. But first, I'm going to need one lucky contestant to come on down. So who is going to help me out today? Don't forget, this is a game show, so you win a prize. Who's going to help me out? Come on up. You're my lucky contestant. Come on down.
I'm Kathy Baker, and I'm from CB Manufacturing.
All right, Kathy. So we're going to come on over this way. So first, I'm going to give you your lucky contestant pen. And as a reminder, we're going to use all of you guys as an audience for help. So you've all seen The Price is Right. You're screaming out the answers, trying to help everybody. So this is a game show. Kathy only wins the prize if you guys help her. So we need to get 5 of the 12 categories correct. So this is The Price is Right, guess that number. So how it's going to work is we have the 12 different categories that we just talked about for the statistics. As I pull a category down, you will see 3 numbers. 2 of those 3 numbers will be used to guess the population out of 100 people that live with these conditions on a daily basis within your employee population. Okay, so let's start with overweight. First category. So we have the numbers 0, 6, and 9. Remember, this is a game show. You guys need to help scream it out. You will use 2 of these numbers to decide how many in your employee population are overweight. 69. Go ahead and write it on your board. 69. What do we think? Who agrees? Who agrees? Yes! Let's check it out. Oh, answer 69 out of 100. Correct. Awesome. All right, next category, pre-diabetes. We have the numbers 9, 8, and 3. What do we think it is? Out of 100 people in your population.
83.
This is a tough one. Tough one. What do you guys think? What do you think? 39. Go ahead and write it down. Let's check and see how we did. All right. Answer is 39 out of 100. We are on goal 2 right now. All right. The next category is obese. We have the numbers 3, 1, and 6. What do you guys think?
36.
36. Let's check it. 36. How we do? 36. Yeah, we are 3 for 3 right now. Next category, high triglycerides. 3, 3, and 4. 33. All right, let's take a look. 33. Guys, all right, high blood pressure. We have 3, 9, and 3. 39. All right, let's take a look. 33. Oh, so close, but we have 4 of 5. We just need 1 more in order to win that prize. All right, smoking. We have 2, 9, and 1. What do we think that number is of your employee population size of 100? 29. Let's figure it out. Oh, so close. 19. All right, diabetes is our next category. We have the numbers 2, 6, and 1. Remember, audience, help Kathy. We need 1 more to win that prize.
12.
And as a reminder, companies are different. These are just statistics. 12 out of 100. All right, so we're still at 4. She needs 1 more to win that prize. We have numbers 1, 3, and 7. High cholesterol is the category. For employee population of 100.
17.
All right, let's see how close Kathy is. 17. All right, even though she's won, we're going to keep going on. Chronic pain. We have the numbers 1, 4, and 5. What do we think? 15. Chronic pain. 41 out of 100 in your employee population are living with chronic pain. So sleep issues. On a daily basis. We have the numbers 7, 6, 2 of those numbers, your employee population of 100 have sleep issues. 62.
62.
62. 62 out of 100 fail to get enough physical activity. 5, 4, and 9. And the answer is 95. None of us in this room are part of that statistic. We need our physical. So struggling with stress. How many struggle with stress? Out of your employee population of 100, 7, 7, and 3.
Lucky 7.
All right, our last category. 77 out of 100 struggle with stress. Yes, you guys got more than 5. Thank you for participating. Thank you, oh yeah, we should have had a final showdown. I didn't think that far in advance. All right, so those statistics.
36.
Those statistics are a little bit scary, a little bit crazy. Once again, all of those statistics lead to higher problems and issues that affect those bottom line. And so if we're not helping our employees understand if they're at risk, how do they know if they're at risk? So let's work on that together so we don't get to those statistics. So just as a reminder, how close were you? So 69 out of 100 are overweight. 39 have pre-diabetes. This is the number we really want to focus on, because if we can help change that around and manage pre-diabetes before it gets to diabetes, it's really going to help them out. 36 of those are obese. 33 have high triglycerides. 33 high blood pressure. 19 smoke. 12 have diabetes. 3 of these 12 don't know it. So they aren't managing that. They are not visiting a primary care physician, and they're more likely to visit an ER room. What does that ER room do to your guys' bottom line as the employer? 17 have high cholesterol. 41 live with chronic pain. 62 have sleep issues. 95 fail to get enough physical activity, and 77 struggle with stress. Of all of these statistics, which one sticks out to you guys the most? Anybody? Physical activity? That's a lot. So throughout this presentation, we're going to talk a lot about health management and that clinical data. But I want to remind all of you that the wellness portion of physical activity nutrition is still a really important piece. But we also need to add that clinical part with your wellness or health management plan. So we're going to go through the essentials of a health management program. And obviously it's no surprise to any of us that the healthcare costs are climbing, and then the health of Americans are declining. So the cost of health insurance in the United States is a major factor in access to health coverage. So the rising cost of health insurance leads to more consumers to go without coverage, and increased insurance costs and accompanying rise in the cost of healthcare expenses has led to health insurers to provide policies that have higher deductibles and more limitations that require the consumer to pay a greater share of the cost themselves. So in hindsight, we're trying to teach that healthcare individual how to make smart, healthy decisions with their dollar. So 2/3 of the U.S. healthcare spending is for chronic diseases among people younger than 65. All of those 12 categories that we talked about earlier are leading to these statistics of 2/3 with chronic diseases. So that includes heart disease, cancer, depression, diabetes, and high blood pressure. So every dollar spent, 75 cents went towards treating patients with one or more of these chronic diseases. So 150 million Americans with one or more chronic conditions, but yet we only spend 5 cents of the dollar on preventing these chronic conditions. So statistics show that we really need to empower and help educate our employees to staying smart and figuring out if they're with these chronic conditions and how to manage that. All right, so we have some studies where it shows that health predicts healthcare costs. So as you can see from these studies, that both increases and decreases in health risks were associated with corresponding changes in healthcare costs. So as the amount of risks grew, the number of dollars per employees grew. That's obvious, but how do we help them lower those risks? We have to provide solutions and programs to be put into place to help educate them on how they can lower those risks. 95 who don't get enough physical activity, how do we teach them that they can do physical activity by just standing, walking around the office, taking short breaks? There's different ways, but if we as employers need to implement this into your programs. So those that were reducing health risks between year 1 and year 2, they were linked to a decline in average annual healthcare costs of about $97 per each risk reduced. So this suggests that there was an asymmetric relationship between risk change and cost change. So that is a reduction in health risks was associated with a reduction in healthcare costs in the same year. So health management versus wellness. There's a lot of chatter about what does wellness mean? What does health management mean? I'd like to get your guys' opinion, your definition of wellness. What do you guys think of this when you hear this term?
I think it's a holistic thing. It's not just your biometrics, it's how you're handling stress, whether you're happy, different things in your life.
Yep, I'd agree. We all agree?
Yeah.
Yeah? Do you have one too?
Eating healthy.
Eating healthy? That's absolutely a part of it. Anybody else? Definition of wellness. So they've done some studies on the street, just going around asking people their definition of wellness. We hear it quite often: physical activity, nutrition. But that piece that sometimes is missing in people's mindset is that health management piece, detecting risk, finding a primary care physician, getting your preventative exams done. So if we are able to cohese both of those definitions, then we're setting up a successful health management plan or wellness plan and building that culture around it. So workplace wellness, our definition that we've come to is that it is an organized, employer-sponsored program that is designed to support employees and sometimes their families as they adopt and sustain behaviors that reduce health risks, improve quality of life, enhance personal effectiveness, and benefit the organization's bottom line. So employers are continually trying to lower their healthcare costs. But why? Is it really working? So if you just have that wellness piece, so those activity challenges, those 5K walks, go ahead, let's do this drinking water challenge, those are wonderful. But those are just lifestyle changes, and we can't really see if that's affecting each individual. So if you're asking if these are effective, by implementing both of them together is where we're finding the most benefit. So health management and wellness programs are simply a valuable tool for cutting down healthcare expenses. Proactive approaches to wellness are now widely accepted as both cost-effective and necessary for a successful benefits plan. So one study found that at least 1/4 of healthcare costs incurred by working adults are attributed to changeable health risks, such as tobacco use, diet, and lack of exercise. 1/4. So if we can provide these tools to our employees, let's help change it and mitigate that risk. So workplace wellness, it's under scrutiny today. There's a lot of articles of does it work, how does it work, is it really worth it, the time, the effort, the planning. So skeptics argue, is there really a return on investment? So what's the truth? So wellness plans, if you look at it from a high level and implement it properly, it can truly work. Okay. So, but wellness by itself doesn't work. Lifestyle changes is not going to work. So what are some important discoveries that we've found? Modifiable lifestyle factors, estimate the costs associated with poor lifestyle, risks and costs increase primarily because of age, changes in lifestyle factors are associated with changes in costs, and we can predict future diseases and cost increases. There's a couple of things that we need to put into place in order to find all of these discoveries. So at-risk employees suffer from factors like overweight, blood pressure, diabetes, and depression, which can lead to costly and avoidable health claims. At-risk people should be identified through personal health assessments and biometric screenings. They should also be personalized in care management programs to minimize their chances of becoming chronically ill. Some people ask how you can do this. How is this HIPAA compliant? So a lot of times when you're connecting people with solutions due to their individualized results, it takes a third-party vendor. So sometimes there are costs associated to you as an employer in order to help. But that's the bottom line. We are helping the employees become smart about their choices and to become knowledgeable. How do we help our employees? All of us want our employees to last and be around and be happy and healthy, not just at work, but when they go home to the most important people, and that's their family. So if they don't know if they're at risk because we as employers choose to not implement these programs, then we are not helping them. So while keeping at-risk employees healthy is critical, the shorter-term workplace wellness ROI lies in the chronically ill. So those who suffer from costly conditions such as diabetes, heart conditions, and cancer. So in a typical population, they consume at least 50% of the company's claims expenses. So those that are chronically ill, have diabetes or pre-diabetes, and not treating it, they are taking over your healthcare dollar that you are spending. So these discoveries have come from the University of Michigan. Boo. They've collected this data through HRAs, biometric screenings, and then different productivity. So absenteeism and productivity is what they've been looking at. So they've seen that cost is in correlation with health risks and not knowledgeable employees. So where do we start? So we're going to talk today about wellness program to wellness culture, biometric screenings, metabolic syndrome, diabetes, what is it, how does it affect our company, preventative screenings, and then tobacco. All right, so I have a little bit of a wellness video that I'm going to play. This is supposed to be a fun video.
Team fasting is something Veronica brought up, and I'm like, okay, this is not India, but still, I thought, why not try it? So our insurance company basically set us up with LifeForce, a wellness program that I was chosen to be made the champion of. Anybody else have any ideas about how we can be well?
We could have a dance party. Dance parties make me want to drink.
Dance parties make me want to put on goth makeup.
Like Cher?
Cher's a pop star.
Oh, yeah, pop goth. She's a poth. I also am responsible for emailing the LifeForce newsletter.
I hate getting those emails.
The employees love the newsletter.
It's totally ineffectual.
Everybody deletes them. They're so stupid. Suggestion for the day? Bounce in your chair. It's a great idea. Burns calories, right? Just... Got the emails, too.
Yes, I do. I have seen a huge difference in the eating habits of everyone around here.
LifeForce recommends snacks that are packed full of sugar and processed.
As you can see, we've been delivered a supply of the shake here. It's the wellness program's fortified drink. It's a complete meal. It's got bioflavonoids, carotenoids, adenoids.
Everyone is drinking it, and I've noticed some side effects. People are twitching.
I have not experienced anything.
Okay, so that is just a little video Fun video, but obviously wellness committees, wellness programs don't work if it's not planned out properly. What did we see wrong in this video? What didn't work in this video? Everything. They were only talking about nutrition, not even the right nutrition, talking about dieting, drinking shakes, not the right shakes, not the right thing to talk about. They only had wellness, what they thought was wellness, implemented. They didn't have those health management strategies and empowering healthier living strategies. So right now we're going to talk about wellness program to wellness culture. How do we build that wellness culture and take the first steps? How many of you in the room have some sort of wellness health management implemented in your companies today? Anything from biometric screenings to just physical activities. Okay, so our first start to doing this is trying to figure out how do we get everybody on board, that entire C-suite, that leadership team. It's going to take CEO, CFO, HR director, managers and employers, everybody at the top of the line to be on the same page. You need that CFO because some things may cost money, and if that CFO is on board, they're going to say, I see a benefit in it. You're going to need HR on board because those are the people that work with your employees every single day. You're going to need CEO involved and on board. So right now, wellness typically means that the CEO, what do they want to do? They want to reduce healthcare costs. They don't know how to do it. They hear wellness, but is there really an ROI? HR, they want to reduce absenteeism, workers' comp, short-term disability. Managers, they want to increase productivity and engagement. And then employees want to be healthy and engaged. Why don't we give that to them? So what wellness really should mean is that everybody's on the same page and the same organizational strategy. We have employees that are healthier and engaged, managers are happier and productive employees, HR has improved morale and retention, and then CEO and leadership. They have higher performance and lower costs. We all want that. Yes. How do we find it? Let's get it together. So we need leadership, cohesive as one. Mission and vision needs to be clearly stated. Employees need to understand what's being asked of them and why. You know, sometimes we feel, why do we have to give a why? But some employees need to hear that why. And it's not just the lower healthcare costs. It's to help them be happier and healthier when they return home. Employees should be empowered to make the right decisions and empowered to do physical activity throughout the day and get up and walk around and take those breaks. And then accountability needs to be embraced. So if accountability isn't there, you're not holding your employees to a standard of, if you do this, then you get this. Then they don't care. They have zero skin in the game. It's not important to them. And then we also need to provide our employees with the correct tools and resources to help them get to those solutions. So what do we mean by a culture of health? So we're going to talk a little bit about what's wrong versus the right approach. So disadvantages with the wrong approach. So knowing your numbers rarely translates into action. So we talk a lot about phase one being that biometric screening and helping employees understand their numbers. Now the perfect employee would get their numbers from their screening, go to their doctor, say, help me, I want to fix these, let's get on a program. But does that happen? How many of you would do that? Not many of us. And then, so we need to help provide those solutions and programs after that biometric screening. So number two, results tell individuals what they likely already know. So just emphasizing that screening is not helping them as much. So HRAs and biometric screenings can sometimes feel threatening, especially when tied to an incentive and penalty. So the right approach would help them understand this is a positive thing the company is doing for you. The company is paying for this because we want you to experience a positive experience. And then wrong way is it lacks self-confidence and engagement, so finding the right engagement. And then it may drive negative emotions, which tend to narrow awareness. People aren't listening when they're told what's wrong with them. So the advantages of what the right approach is. So it can provide a positive mindset for our good health. It can promote self-efficacy. It can approach, broaden, aware, and enhance creative and complex thinking. It is more likely to tap into intrinsic motivators and promote sustainable engagement as long as we build the culture productively. So why does culture matter? So let's rethink business for in the case of employee well-being. So fusion of organizational and employee well-being is critical to a thriving workplace culture. Defining organizational culture, the critical role of leadership, and becoming a cultural influencer. So culture will eat strategy for breakfast. We can all build a strategy, but if we didn't have strategy to build that culture, that strategy does not matter. So if people don't feel valued or trust in the company, then the culture is not going to change in a positive way. So culture has become a popular buzzword when it comes to addressing employee health, safety, and engagement. And the wellness health management industry increasingly focuses on building a culture of health. So this will require rethinking your role in a way that allows well-being to be embedded into leadership development and culture improvement efforts. So as we heard earlier, this could be a holistic approach. Mindfulness, dealing with the 77 employees that struggle with stress. Physical activity, the 95 who fail to get enough physical activity on a daily basis. Those overweight, 69 out of 100 overweight, let's help them. But we need to build that culture. So currently, within the next 5 years, millennials, so those that were born between 1980 and 1995, currently under 33, will make up 40% of the workforce in America. In 10 years, this will comprise 75% of the workforce. So one of those big pushes for millennials to see inside of a company is a push for health and well-being. If 75% of your company are going to be millennials in 10 years, let's figure out a culture of well-being now so it's ready for those millennials when they get there. So in a workforce study, they found that in the highest performing cultures, leaders not only created the conditions for high levels of engagement, but they also create environments to support productivity and performance. And they help employees feel a greater sense of physical, emotional, and social well-being at work. People feel energized. So Pat McGohan, our CEO here at McGohan Brabender, instilled this in us about 10 years ago. He instilled the culture of health to make us feel empowered to get up and exercise, to walk around, to empower our clients to understand the importance of this, to then empower their employees. So be a culture influencer. Lead the change in your company. Replace ineffective behaviors with powerful new skills to make things happen. So biometric screenings, metabolic syndrome, and diabetes. So raise your hand if you in the room right now have biometric screenings implemented in your company. Perfect. Phase 1, helping your employees find the data, find the risk. All right, so a biometric screening, for those of you that may not know, it's defined as the measurement of physical characteristics such as height, weight, waist circumference, blood pressure, blood cholesterol, and glucose levels. That can be taken at a work site or at a primary care physician or even Kroger Minute Clinic, little clinics. And it evaluates the changes in employee health status over time. There are many reasons to have a biometric screening, but overall it's to track the health of employees and improve their health. So health promotion is the main concern for fitness trainers and health consultants. However, part of that job is also analyzing the data just like any other scientific process. There are many components to biometric screening, but once someone obtains their information, they can do something with that, and we as employers can help them understand it. So a successful employee health management program varies in different services. Sometimes we have biometric screenings along with a program or a solution to help them. Sometimes it's health coaching. Sometimes it's lunch and learns. Whatever fits in your culture is what you need to work on implementing. Not everybody's is going to look the same. There's no one specific route to take, but let's figure out the right way for your culture. So when deciding whether or not to implement a screening or program, you need to examine your existing culture or come up with the right strategy. So the following items should be taken into consideration. So goals of the program. What do we want to get out of it? Do we want to see participation and engagement? Do we want to see where the risks are and what we want to focus on? Cholesterol, stress, high blood pressure. Integration of the screenings into overall health management approach. So what's our approach? Participation-based, or is it going to be incentivized? Overall business culture and makeup. Your locations of the population. So some of you just have one location. Some of you have one location in Dayton, Ohio, and one in California. So the location of your population is important to look at. What does the screening measure include? Are we going to look at the metabolic syndrome risk factors, or are we going to look at BMI as a risk factor? Who do we want to screen? Just employees, employee spouses, dependents? What is our goal? Privacy and privacy considerations, helping communicate to your employees to help them understand through HIPAA compliance, you as the employer will never see their results. You see aggregate data. The operational and implementation considerations, regulatory and compliance considerations, incentive or surcharge strategy, how it's going to affect your benefit plan design, and evaluation measures. And also your screening budget. There are ways to look at this. What vendor can bill directly through claims? What vendor costs $35 for a screening compared to $60 for a screening? We just want to send our employees to their primary care physician. There's different factors to look at when implementing that biometric screening. Also, me as a health management and engagement specialist, a resource here at McGohan Brabender, I'm here to help sit down and strategize and guide and assist the way that we want to build this strategy. We would also look at if you're fully insured versus self-funded locations, how many employees, third-party vendor, and then providing solutions beyond the biometric screening. So we have some top 5 reasons for biometric screening. Number 1 being it's a reliable crystal ball and it's still on the drawing board. People can see their risk factor numbers, see if they are at risk for further chronic diseases. Because your personal information is protected. As we said, employees are the only people who see their individual scores. Number 3, it's fast, it's easy, and it's free. It's free to employees under ACA rulings. Number 4, because the only thing that you have to fear is fear itself. And then because what you don't know can hurt you. If you don't know if you're at risk, you don't know to be managing that risk. So through a biometric screening, we can identify health risks for both individual employee and employee population by aggregate data, stratify the population to identify different opportunities to help them improve. We can structure the plan benefits design, and we can target health interventions. We can tailor health management programs to individual employee needs. You would need to have a third-party vendor to individualize those. And then identify objective measures. All right, so metabolic syndrome. We talk a lot about MET-S here at McGohan Brabender, but a lot of times people say, what is MET-S? So metabolic syndrome is not a disease in itself. It is a cluster of risk factors that make up high blood pressure, fasting glucose, HDL cholesterol, triglycerides, and waist circumference that then lead to further chronic conditions. But when you're combined, just having one risk factor out of range is not the best. But when you're combining 3 of these, that's when you're getting into the statistic of diabetes, pre-diabetes, and we want to change that statistic before it gets there. Sometimes people ask, why does MET-S not calculate BMI? So BMI, body mass index, is a ratio of weight to height. So body fat testing involves estimating the percentage of body mass that is composed of both lean and fat mass. Although BMI provides a standard measurement, it's misleading. For those that have more muscle compared to weight, it's putting them in a different category. So when we're looking at waist circumference instead, it's helping to get the true calculation of if they are at risk. So it's the most appropriate way of identifying those risks of morbidities associated with obesity. The purpose, goals, and incentive structure of the program need to be taken into consideration when choosing waist circumference over BMI. Some insurance companies like to look at BMI. So Real Appeal through United Healthcare right now, BMI is the factor of what helps them get into the program. So whenever we have our clients that are working with Real Appeal, we try to get them to understand, do BMI and waist circumference. That way you can see the utilization of both. Some more statistics for you. An employee that is known to have metabolic syndrome, so the cluster of 3 or more, has a 7 times greater risk of being type 2 diabetes in the future. And then an employee with metabolic syndrome has 3 times greater risk of having a cardiac episode. What does this do to your bottom line? So this is taken from the Center for Disease Control. These are some national averages. 86 million Americans have prediabetes. 77 million are unaware. 77 million Americans are unaware. 29 million Americans have diabetes, and then 8 million are undiagnosed. 21 million of those that are diagnosed, 4 million are diagnosed but not treated. They're not seeing their primary care physician on a regular basis. 17 million of those that are treated, 8.5 million are treated but not successfully controlled. But, pause this, 8.5 million have their disease under control. Let's look at the difference between 8.5 million and 20.5 million have diabetes that are not controlled. We don't want our employee population to be part of these statistics. Us, as employers, need to empower and educate them on how to fix this before it gets there. So 26 million Americans are diabetic, 80 million are pre-diabetic, 1 in 10 employees diabetic, 3 others are pre-diabetic. By 2020, 5 in 10 will be diabetic or pre-diabetic. So look at our tables right now. 5 of 10 in 2020 are going to be diabetic or pre-diabetic. But 70% of diabetics don't test on a regular basis, and this goes to 40% of your own healthcare dollar. So those that are testing or on a regular basis are not affecting your healthcare dollar as much as those that are not testing. So how come they're still paying the same amount for their insurance premium? An average yearly cost for a healthy individual is $1,721. Average yearly cost for a diabetic is $22,512. Some big differences. But we don't want to point out those diabetics because every dollar spent on diabetes medication, so those employees that are managing it, that are taking their medications on a regular basis, seeing their primary care physician, actually saves $7 in medical costs. It's those ones that are not managing it. So once again, providing the right solution. We have vendors that have programs that can be put into place to help those diabetics test on a regular basis and understand the importance of it. Preventative exams. So once again, this is another piece of implementing empowering healthier living strategies. So implementation of a program that requires certain preventative exams as recommended by American Medical Association at the recommendation screening intervals. So as we said, phase 1, step 1 of implementing EHL, those biometric screenings. Very important first step. You're building that culture and awareness to your employees. Second step, we would say are preventative exams. So early detection of the risk factors for certain health conditions can lead to lower disease rates, increased morbidity rates, reduced employer health care costs, reduced absenteeism, enhanced job satisfaction, and increased productivity. So cancer prevention and early detection in particular are important to long-term strategies to reduce cost. But this needs to be inside of your strategy. When you're sitting down with that leadership team, how far are we willing to go? Are we just going to do biometric screenings? Are we going to ask them to do biometric screenings, preventative exams, based on risks? How far are we willing to go? So let's look at some statistics here. So colon cancer claims in the early stages cost $12,000, late stages $126,000. So if we are not asking our employees to go to the doctor and get their preventative exams, they could be in the late stages of colon cancer. And beyond the price difference, their health is in jeopardy. So if we care about our employees, how can we help them understand that we want them to do this for their own health? Prostate cancer, $13,000 for early stage, and then late stage, $54,000. So that's a difference of $41,000. Breast cancer, $16,000 a year, early stage. Late stage is $108,000, and these are just national statistics. Difference being of $92,000. And then cervical cancer claims, $16,000 a year at the beginning, $84,000 a year at the late stages. So this right here could make a difference in your bottom line and what your employees are paying for their medical premiums. So what to measure? So age and gender appropriate preventative screening as recommended by U.S. Preventative Task Force. So breast cancer based on age, cervical cancer, colorectal screenings. And then how do you measure this? You can't just walk up to somebody and say, you're 21, you need to go get your breast cancer screening. So we use third-party vendors. There's many options out there that can help track this. Online tools, nurses on site, nurse coaches on site. There's different ways to do it. That way you as the employer are not violating any HIPAA laws. You're staying in compliant of how to teach your employees to get their preventative screening. And then who to measure. The employees, all employees covered under the medical plan should be doing this. So we work closely with a vendor called Care One Connect, and they have done a primary care physician survey. So those employees that do not have a primary care physician and seeing them on a regular basis and that we're not asking them to do their preventative screening are going to be some of these statistics that aren't getting them done. So number of employees surveyed is 100, 44 of the completed surveys. So 34 were members on the medical plan, making up 77% of this total, and then 10 were non-members. So 14 females and 29 males. Average age of the male was 44 and female average age was 37. So of those that have a PCP were 9 females and 12 males. Employees with or without a primary care physician. 23 employees do not have a primary care physician. So where are they going when they get sick or they think something is wrong? ER. Urgent care. All of those things.
Little mini clinics.
That are affecting the employer health care dollar. 21 employees do have a PCP. Primary care physician visits. 58% have never been to a PCP. 28% within the past year, 8% 1 year, 4% 2 years, 4% 3 to 5 years, 4% 5+ years. These are not good statistics. How can we empower our employees to find a PCP, establish a relationship with a PCP, and getting their screenings done? Annual wellness visit. Only 43% have taken advantage of their no-cost, once-a-year wellness visit. All of our insurance carriers under ACA, everybody is given a wellness visit free of no charge to all employees. 43% are taking advantage of that. Employees that go to a preferred PCP. So if you have United Healthcare, it's that Tier 1 PCP, Anthem Blue Distinctive. So it's the one that you're finding the best quality and cost association. Only 38% are going to that preferred primary care physician. Emergency care. 32% have gone to the emergency within the last year, and this was an unnecessary visit. 16% have gone to the urgent care within the last year. When asked if their health was significantly important, 95% said yes, 5% said no. So if it's important to them, why not bring it to the workplace? They correlate the importance. So now we're going to talk about tobacco. Nobody cheat, but as a reminder, employee population of 100, how many are smokers?
19.
19. Too many. Too many. They're expensive to your bottom line. They are out taking smoke breaks, so they are not as effective at work. So tobacco cessation. If this is an approach that identifies tobacco users through either testing or affidavits and provides a tobacco cessation program. So if you implement a tobacco surcharge, you must offer a reasonable alternative. Under ACA, they found that tobacco use were choices, but yet it was affecting the employer. And you as employers that are having to pay for healthcare costs, they decided it was of importance to be able to implement those tobacco surcharges. But we also need to give flexibility just to be able to educate employees about tobacco use. So to refresh, if you implement a surcharge, an employee says they want to be offered a reasonable alternative, they complete that reasonable alternative, whatever you decide that may be, just has to be reasonable. If they complete that, they cannot be given a tobacco surcharge. So just because they didn't quit smoking doesn't mean that they have to receive the penalty. If they completed the surcharge or the cessation program that you asked them to do, they are good until the next year. So tobacco use continues to be one of the most costly, deadly addictions. Employer health care plans and tobacco cessation remains the most cost-effective health benefit employers can provide. Employees who smoke cost employers approximately $5,800 per year per smoking, according to a research study by The Ohio State University, not Michigan this time. So the study also found impact in other employer areas. So higher life insurance premiums, increased absenteeism, more time spent on smoking breaks, greater risk of occupational injuries, more disability claims, increased cleaning and maintenance, and more disciplinary actions. So instead of looking at smokers just to the bottom line of your insurance, look at the other statistics. So what to address? Options include cigarettes, smokeless tobacco, and e-cigarettes. A lot of people now include vapor and pipes and cigars. Whatever it may be, it needs to be written and stated clearly to all of your employees in an affidavit or your communication that you give out about it. So how do we stratify? So employers can have members complete either affidavits or be nicotine tested. While testing is more accurate, there's more legal and compliance and premium differential issues to consider. So we always talk about consult with your legal counsel, and we are here to guide and add assistance, but legal counsel is going to be your best option. So who do we look at? Employees, employee spouses, covered dependents. What are we going to look at based on your culture that you built for that wellness? So do we provide a surcharge for those tobacco users or a non-tobacco use incentive? How did we build the culture? So does the employer want to invest time and resources towards a tobacco cessation program, or is the approach just to penalize those who make the conscious decision to drive higher claims on the plan? So this answer will then drive the appropriate cessation program. All of these are to take into consideration when thinking about implementing a tobacco surcharge. How do we hold them accountable? So premium differentials can vary up to 50% of the employee-only for their premiums for tobacco users, depending on how stratification is conducted. So once again, there are different rates for those that do an affidavit versus nicotine testing. So programs can range in cost from $0 to a few $100s per participant based on your overall stick versus carrot approach. So keep in mind you get what you pay for. So a lot of the insurance carriers, they have free tobacco cessation programs or drugs. Smokefree.gov, free programs. Your county, Montgomery County, they have free programs and classes, which are all really great, but sometimes you can't get the right reporting that you need. sometimes is it really effective? Are they just running through the videos? Are they just listening to this online person talk to them so that way they can't get surcharged? But then we have some more that are more expensive that we work with, but they change behavior. Here at McGohan Brabender, we had 3 smokers, tobacco users. We went through a program called Trestle Tree, and 2 of those 3 smoked tobacco users stopped smoking. So sometimes putting more money in the front end is going to help you in the back end, because now those tobacco users are not costing the plan $5,800 per year. So what can we do? So we want to find your risk and address the risk. We want to look at employee engagement and communication. And then we want to take action to impact health and healthcare. So what have we learned? So today we've been talking about phase 1, biometric screenings, implementation of those, helping your employees find their risk factors and how to address that. Preventative screenings, important. And then physical activity and lifestyle changes are still important to implement as well, but it needs to be tied with that health management portion. So phase 2, we talked about implementing all of phase 1, but then helping provide the people with the solutions, helping them find the programs that work for them, individualized results, and programs that go along with that. Third-party vendors need to be helping out with that. You as employers have HIPAA compliance to think about, so to provide the right solution, we need that third-party vendor. So what are the pillars of an effective workplace wellness program? So number 1, multi-leadership. So creating that culture of health takes passion from the C-suite and the middle managers. Remember, everybody on the same page. Number 2, alignment. So a natural extension of a firm's identity and aspirations. Number 3, scope. So you must have a comprehensive and engaging program. Number 4, communications. It's not just a mission. You guys live it day in and day out at your workforce. Everybody is talking about it. Everybody understands it. Number 5, partnerships. So active and ongoing collaboration with different vendors, your insurance carriers, your broker, us. And then number 6, accessibility. So aim to make this low or no cost and easily accessible for your employees. So outcomes. So we all want to have lower costs, greater productivity, and higher morale. So a successful employee health management program varies greatly in services, as we've said before. But one of the most important is health risk identification tools, such as health risk assessments, biometric screenings, based on metabolic syndrome. Number 2, behavioral modification programs. So that could be health coaching, tobacco cessation, weight management, nutrition and diet, exercise, stress management, that holistic approach. Number 3, educational programs. So providing your employees with a health fair and seminars, on-site and online health resources, easily accessible to them. And number 4, changes to workplace environment and culture. So tobacco bans, altering buildings and grounds to encourage walking, healthier foods in a workplace cafeterias and vending machines changing, and wellness-related management training and performance goals. So those that are at the top of the chain are understanding what health management is. So by implementing these, we will all be able to receive lower costs, greater productivity, higher morale, and keeping our employees happier and healthier to have healthier birthdays. So what are some barriers to employee engagement and participation? So beyond these 5, have you all seen or heard what employees complain about your wellness or health management program? So up here we have trust, time, money, convenience, and stress.
They don't want to be told what to do.
Not told what to do. Anybody else? All right. So let's go through these 5. So trust. It takes the lead as the biggest barrier. So what are my employer intentions, concerns about confidentiality of information, and program credibility? So almost 1/4 of participants indicate that they do not participate in a company-sponsored wellness program because they aren't sure what the company is going to do with the information. How do we address that? Number 2, time. That's a major barrier due to the other commitments employees have. In addition to holding a full-time job, many are going to school, working another job, or have elderly parents or small children. Number 3, money. So many employees, especially those who believe they have to choose between their basic needs, such as buying food and paying for prescriptions and covering the cost of their copays. Number 4, convenience is a factor. For those who lead a hectic lifestyle, the challenges employees indicate that they face include finding time to eat healthy, cook healthy, and be physically active. And number 5, stress. Stress is a major barrier for those who have too many commitments or who perceive lifestyle change as a burden. Family and loved ones can serve as a barrier to employees who are trying to make healthy lifestyle changes because of their strong influence on employees' behavior and choices. So for women, guilt about making their health a priority seems to be a big barrier, especially for mothers and healthcare workers. And then for men, they've indicated they don't want to be told what to do. So these are all barriers that any CEO, CFO, HR managers could say. But let's find a way to make our health management plan successful to get around this. How do we create that culture so these barriers don't get in the way? One of those is starting with creating effective communication. So frequency of communication and clear and concise communication. So studies have shown that employees have indicated that they want clear and concise communications not only on their benefits, but also on their wellness plan. What's being asked of them? What are dates when things are happening? And what do I need to do in order to receive the incentive or avoid the surcharge? Print communications are still important, but as we spoke about, millennials are becoming a big part of companies. Millennials like emails and text messages. So let's think about the way that we are communicating to our employees. Personalized communications and information specific to the employees individually, and challenges are preferred. People still like those challenges. It's building up morale, so that wellness piece should still be implemented. And then employees want more frequent communications and meetings to learn about what is available to them. Spouses and physicians, they want to know. So just because you don't have spouses included in your health management plan doesn't mean that they don't want to know what's being asked of their spouse at their employer. Physicians as well. So if we're sending out these communication pieces, employees are more likely to take them with them to their doctor or take them home. So ACA, as I talked about earlier, some of those changes just recently came out within the last 3 weeks. We still have 2 different plans for wellness. We still have the participation base, which is screening incentives, lunch and learns, complete a health risk assessment, fitness center, 10,000 steps challenges, regardless of health factors. So we're not looking at providing them a program or solution. That would be considered participation based. Then we have health contingent. So activity only is coaching programs, diet programs, exercise, tobacco, based on their results. Outcomes based, and then outcomes based is based on their actual results. So some of the new rules have come out between the activity only and outcomes based. So participation must always be voluntary. You can never say that your wellness or health management plan program is mandatory. It can say you will receive the incentive if you choose to participate, but it's always voluntary. And there can never be denial of coverage or other coverage limits under the employer's group health plan for non-participation. So you can't say because you chose to not participate in the wellness program, you have to go into the lowest plan where you pay the most. Under the new rules, that's not allowed. And then no adverse employment action can be against employees who choose not to participate or do not achieve certain health outcomes. And then no gateway health plans requiring individuals to participate in a wellness program to be eligible for coverage on a particular health plan. Required notice. Under ACA, you must tell your employees what you're asking of them for a health management plan. It must be in a written document where they are seeing what they need to do in order to achieve that incentive or avoid the surcharge. Privacy of information. So medical information collected can never go in, individual results can never go to the employer. It must have PHI, so protected health information. And incentive limits. This is where it's changed a little bit. So if an employee and a spouse participate in a wellness program, previously it used to be that it could be 30% of the cost of either the family or the single. Well, starting 1/1/17, you cannot take 30% of the family premium anymore. It will always be of the single premium. So let's say that $6,000 is the employee and the employer contribution, both of them put together. And 30% of that single premium is $1,800. So that incentive or surcharge cannot be more than $1,800 for the entire year. So financial benefits. So the current ROI debate has focused on whether one type of wellness program, lifestyle management, which is just the fluffy wellness, exercise, diet, can they actually reduce healthcare claims to lead to lower costs? What have we learned today? No, not just wellness. We need to implement those health management. When you implement Empowering Healthier Living health management programs, you are more likely to see those financial benefits. It takes time to see that. And a lot of times right now we like to talk more about ROI, not ROI, but talk about VOI, so volume of investment, instead of return. When we hear ROI, we only think of the financial benefits. But if you provide for your employees an on-site biometric screening, an employee gets to that screening, they are out of range for 4 of those 5 risk factors. It happened here at McGohan Brabender. Looks healthy, exercise, doesn't eat bad. That member, that employee went to the screening, out of range for 4 of the 5, was sent directly to the hospital. He was en route without even knowing to be pre-diabetic. So what is the ROI of that? You can't tell me that you saw, because he didn't have that heart attack and had to go to the ER, those claims didn't happen. VOI, that volume of investment. He was able to manage that risk, take medication, do a program, whatever it was, and then come back to work that next day. So that is the volume of helping your employees. So while companies certainly care about the well-being of their employees, benefit decision makers admit that their primary reason their company maintains a wellness program is to help curb healthcare costs. And 59% of the companies agree that wellness health management programs can help reduce these costs. So despite the benefits of wellness programs, nearly a quarter, so 22% of companies do not offer them for their workforce due to the difficulty in quantifying the return on investment. So if we can help employers understand that if you're only looking at ROI, your program is not going to be successful. We need to look at other things instead. So right now we're just going to go through a 2015 Milliman study. So different wellness programs and options that have been offered. So 19% offer an EAP program. That's considered to be part of your wellness strategy and should be implemented with your wellness strategy. Flu shots, 17%. Web-based resources for healthy living, 13%. Blood pressure screening and cholesterol screening, 12%, so meaning a biometric screening. Top 3 incentives, gift cards at 32%, lower employee medical contributions, 30%, so those premium differentials, and then recognition, 25%. So reasons for offering wellness program. 58% of companies said it was to improve the health of their employees. 24% said to reduce healthcare costs. 10% to improve employee morale and productivity. 6% benefits were part of the health plan. And then 1% to reduce absenteeism, 2% other. So expected ROI on wellness programs. Within 5 years, 78% don't know. Can't factor that. So the high participation rate has led to a host of positive medical outcomes with significant impact on the bottom line, including overall healthcare costs fell to 5% in 2013, substantially lower than historical increases. Emergency rooms visits have decreased by 4% nationally. The cost of back surgeries have dropped by 40%. Early detection of cancers have gone up due to the increase of us as employers implementing preventative exams. And then mail order versus retail prescription. Wellness and disease management incentives, gift cards, lower medical contributions, recognition, merchandise, cash. Self-check. So in the back of your guys' workbook, you just have a self-check. This is where you guys are at today, where you want to maybe go, some things to take back and really think about. So these last 10 minutes, 9 minutes, just feel free to sit and talk with your group about maybe some other things that people have implemented or what you guys think about you want to do to implement something. But thank you all very much, and I appreciate your guys' time.